Hi, I'm Dr. Kelly McCann. I'm actively practicing, researching, and teaching about functional medicine. Okay, I've been talking about phospholipids, phosphatidylcholine in particular, plasmalogens, and mentioning that you can actually test these things besides doing a lipid panel. And I'm sure you're all dying to know, how do I test my plasmalogens if they're so important for cardiovascular health, reduction risk of cancer, and reduction of dementia? I mean, let's talk about it. Those are the horsemen, right? And metabolic dysfunction. So if we can replenish plasmalogens and avoid all those guys, let's do it, right? Dr. Goodenow is a biochemist, and he developed a way to test plasmalogen levels. His test is called the ProdromeSCAN. It's actually not a scan or an imaging test at all. It is a blood test, and it checks cholesterol markers, it checks inflammation markers, it checks things like iron levels, as well as high sensitivity C-reactive protein, uric acid levels, kidney function, and then it checks something called GTAs, gastrointestinal tract acids, which are, if low, linked directly to colon cancer risk and pancreatic cancer risk. So it's helpful for those basic tests as well. But the real beauty of this test, this ProdromeSCAN, is looking at the phospholipids and looking at the plasmalogens. So in September of 22, I contracted COVID. This was the first time I had COVID. And I had terrible brain fog afterwards. I just couldn't get my mojo on. It was like, who's there, right? I mean, clearly I was still seeing patients. I was still practicing. I didn't have to take that much time off other than the time that I was sick, but I knew that I was not normal. And I did Dr. Goodenow's ProdromeSCAN. And this is what we found. So the top two columns are the total phosphatidylethanolaamines, which I mentioned are on the inside of the cell membrane, and then the anethanolamine plasmalogens. And you can see they're pretty low there. This is despite taking Body Bio PC for years, right? And then in terms of the second section, we break it down a little bit further. So my PE levels are very low. My phosphatidylethanolaamine, PE, plasmalogens are also very low. Yikes, that's not good. My phosphatidylcholine molecules are better, but even if we look a deeper dive of the PC plasmalogens, they're still pretty darn low. I needed a ton of plasmalogens to get my brain back. And so that's what I did. Dr. Goodenow also figured out a formula for supplementation that is a precursor, that it gives you the building blocks so you can actually have more nutrients to make your plasmalogens where they're needed. And so I started taking Prodrome Plasmalogen Neuro, and I had to take a lot. I started out taking 4 capsules a day for about 3 weeks. I didn't notice much of anything, I'll be honest. But when I ramped it up to 8 a day, within 3 days, bam, I was back. It was amazing. So loading doses are super important with these supplements in order to really get the level back to where it needs to be so that you can fire on all cylinders. And then after a while, I was able to reduce that back down to a more financially reasonable amount, usually 4 to 6 capsules a day, when I'm feeling like I need to be on fire, right? He also has another supplement called Prodrome Glia, which is a little bit different. It's meant for calming the nervous system, typically taken at night. I had trouble with it at nighttime. It was a little stimulating for me. That's very rare. I'm a little oddball that way, but definitely was super helpful in my brain recovery. A couple other things on the test. They do look at some fatty acids, dietary fatty acids. I was not taking my fish oil, so I really needed to have more building blocks in terms of omega-3 fatty acids, which provide DHA and EPA. And for those of you who are vegans or vegetarians, taking flaxseed, hemp seed, which are the alpha linoleic acids, the healthy plant-based omega-3s, they don't really convert very easily to the DHA and the EPA. And so for brain health, for longevity, for cancer prevention, for cardiovascular disease and metabolic issues, you may need to do some fish oil because it is very difficult to get, especially on a vegan diet. And then there is another page, but it's mostly a reiteration of the first page. So I hope this was helpful. I really love sharing this information with you. I'll see you next time. Hey, and if you have comments or this was helpful, please feel free to subscribe to my channel and share. Until next time.